Let's grab our heaviest Theraband, and our ball will lie back for footwork, lying supine, elevating the pelvis, making sure that the ball is under your tailbone, and you can create some lumbar extension. So you can take the pointer fingers to the bones, the bony protrusions on your hips, and guide them down for lumbar extension. Keep that extension, bracing your abs, and lift your dominant leg into the air. We'll place the heavy Theraband around the metatarsals, especially the bone of your big toe, and extend that leg into the air. You'll dorsiflex your foot, and we're going to work on inversion from the ankle joint, not from the knee. Make sure you're not working from the knee, so you're taking the foot in towards the face, pressing the bone of the big toe into the band, and then back to parallel. No movement in the leg, no movement in the knee. There's only movement in the foot from the ankle joint. Check in with your breath. Are you holding it? Use the breath. Exhale to bring the foot in towards the face from the ankle joint, and inhale back to parallel. Exhale in towards the face and inhale parallel. Go ahead and switch sides, setting up, knowing that the goal of this exercise is not only to open the calf and hamstring, but to work on your feet. The feet are so important because they affect the whole chain. Your back pain is linked to what your feet are doing and how you're using your feet. So there is a lot of benefits. There are a lot of benefits of using your feet correctly. So go ahead and focus on getting that bone of the big toe to press into the band as you move into inversion and back to parallel. Inversion to parallel. Core is engaged. Using your breath. Good. We'll come out of that slowly, making our way up to stand, grabbing a 3-pound weight and coming into a tightrope stance. If the tightrope stance feels very precarious and you feel unable to balance, take it to a wider staggered leg stance. The weight is in the same hand as your front foot. Feet are nice and parallel. Soft bend in the knees. Focus on the weight in the bones of your big toes and take the hand of the same hand as your back leg behind your head. We're going to take lateral flexion here, stretching over and adding the bottom arm as the lever as we did with our knees on the roller. Hold it here. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale and brace the abs coming back up to center. Make sure your torso stays square to the wall in front of you. Your collarbone is wide, your shoulders are plugged down your back, your chin is retracted. We're doing 2 full inhales and exhales, bracing the abs on the exhale, breathing laterally on the inhale, thinking about the sternum reaching towards the back body. Inhale through the nose, brace the abs to support this external oblique work. We really want to strengthen the outer obliques as well as the QL to bring the body upright and protect the back. Your last set on this side, remembering the bones of the big toes are heavy. This will help stabilize you so you don't fall to the side you're bending towards. The knees should be softly bent and tracking over the second and third metatarsals, ideally if you're really pressing into the bones of your big toes to combat that supination. Adding the bottom arm as that lever to increase the load. When you finish this last set, let's switch your staggered stance, switching the weight into the other hand and beginning on the other side. Remembering to inhale, prepare, and exhale, pulling the abdominal wall in, bracing those abs as if you're being punched in the gut. It's also important to think about your tailbone reaching back a bit so you have some lumbar extension, so you're not tucking your butt under. Even though you're bending your knees, you're still keeping some lumbar extension. You're bracing those abs every time you add that long lever, increasing the load on the external obliques. If the neck is straining, turn your head and look down on the diagonal. Retract your chin. Lots of options to recruit the correct muscles and not overwork overactive muscles. Finish up your last set. And once you're finished, you can grab your lightest loop band to place around your ankles and your heaviest Theraband to hold behind your back, pulling out on the band to retract your shoulder blade anchor, your serratus anterior. We'll use a wall like a bar so that if we need to grab it, since we're doing some balance work here, we have it for safety purposes. We're going to be traveling in the frontal plane, stepping to balance. So you'll step towards the wall onto a parallel foot, heavying the bone of the big toe, bringing the other leg into knee flexion. Immediately, keeping a soft bend in the supporting knee, pulling out on the band to retract the serratus anterior, nodding your chin in to engage the front of the neck, keeping your focus eye level or higher, your ribs closed, your tailbone pointing back so that you have lumbar extension. And let's step back. We'll repeat this step to balance. So I don't want you putting the foot down as you step towards the wall. I want you lifting that outside leg up immediately. You can dorsiflex the foot to run energy through the foot. And just make sure that you're not pressing your ribcage forward, that you're thinking about the heart reaching towards the back body to close those ribs and engage the abdominals. One more breath. And let's bring it to the other side. Setting up, stepping to balance. Find it, soft bend in the supporting knee, weight in the bone of the big toe, pulling out on the band, palms are forward, shoulders down the back, collarbone wide, chin retracted. One more inhale and exhale. And let's go ahead and repeat, stepping to balance onto a parallel leg, soft bend in the supporting knee, knee flexion, tailbone reaching away, lumbar extension, shoulder blades retracted, upper back extension, ribs soft, collarbone wide. We'll take the bands and set them to the side, coming to the wall. We'll be taking a T-pec stretch, bringing one arm out to a T and rotating around. Let's use our breath. Inhale, pull the abs in, brace them. Exhale, twist a little further. Inhale, abs in, brace. Exhale, twist. Good. Moving on the breath with control of the core and a soft bend in the knees. Brace and twist. Chin retracted, back of neck long. Inhale, abs in, brace, and twist. We'll go ahead and switch sides. Soft bend in the knees. Inhale, pull the abs in, brace, exhale, twist. Inhale, abs in, brace, exhale, twist. One more, inhale, abs in, brace, and exhale, twist. Turn to face the wall, stepping your dominant leg back. Nice and parallel, look over the shoulder, drive the hips forward as you drive the heel down into a postural calf stretch. We'll be here for a minute, so I really want you to think about your form so that you maximize the stretch. Lengthen out the crown of the head, keep your focus up eye level or a little higher. Collarbone stays wide, heart reaches towards the back ribs so that your rib cage isn't pushing forward. Your hips are pressing towards the wall, keeping them even. Make sure there's not one hiking up. Driving the heel down into the floor to stretch that gastrocnemius, a posturally tight muscle. Check in with your breathing. Inhale, abs in, brace, drive the heel as you drive the hips forward, heel drives down. Inhale, abs in, lift up on the muscles that stop your stream of pee. Hold that lift. Fog a mirror with your exhale. Go ahead and switch sides, starting with the legs hip distance apart and parallel. Stepping the foot back, making sure the foot stayed parallel. You're bending that front knee, driving the hips towards the wall, lifting the abdominals in and up, keeping the collarbone wide, chin retracted. Let's breathe. Inhale, abs in, lift up on the muscles that stop your stream of pee. Hold that lift as you fog a mirror with the exhale. So don't drop that lift to the pelvic floor until you've finished your entire exhale. So the abs stay in until then. Then you can inhale, thinking about breathing into your rib cage like an opera singer, pulling the abs in, lifting in and up. Drive the heel down as the hips go forward as you exhale. Good job. We'll grab our foam roller and our anti-burst ball to set up for squats. We'll use the wall as we step up onto the foam roller, bringing the ball between the inner thighs. Sitting back into a squat, swinging the outside arm into shoulder flexion, plugging the shoulder down the back. Try to not pitch your torso forward. You want your upper body to be on a diagonal. Tailbone through the crown of the head is an upward diagonal. Raise those abs, squeeze in on the ball, inhale, and come back up to stand. Let's try that again. At the bottom, we'll squeeze in on the ball and pulse in. Feel the bones of your big toes pressing into the roller and your feet are wrapping around it. Sit back and exhale, pulse in. 2, 3, 4. Inhale, exhale, pulse. 2, 3, 4. Inhale, exhale, pulse. 2, 3, 4. Stand up tall, arm comes down. Again, sitting back, swinging the arm up, brace the abs, squeeze in on the ball. 2, 3, 4. Inhale, exhale, squeeze. 2, 3, 4. Inhale, exhale, squeeze. 2, 3, 4. And inhale, prepare, exhale, brace, and stand up tall. One more time. Sitting back, use the bones of your big toes. Reach your sternum towards the back body. Brace the abs. Squeezing, pulsing in on that ball on your exhales. Preparing on your inhales. Pulsing again on your exhales. Staying conscious of all your checkpoints. Feet, inner thighs, abs, rib cage, shoulders, neck. Stand up tall, stepping off, holding onto the wall, being careful, and switching sides. We want to swing our other arm up for this one. So same thing, set up. Make sure the ball is between the inner thighs. The bones of the big toes are pressing into the roller as you wrap the feet around the roller like it's a bird wrapping its feet around a branch. And we'll sit back into that chair, tailbone reaching back, arms coming up. Hold, inhale 1, breathe. Exhale 1, inhale 2. Exhale 2, standing up tall, arms come down by the sides. We repeat with our pulses, sitting back, arm up. Retract those shoulder blades, pulsing in on the ball on your exhales. Pausing to prepare on your inhales. Bracing the abs again on your exhales. Standing back up after you've done 2 full inhales and exhales. Inhale, prepare. Exhale, sit back. Last set here. Pulsing in. 2, 3, 4. Inhale, 2, 3, 4. Brace. Exhale, 2, 3, 4. Inhale, 2, 3, 4. Brace and stand up. Stepping carefully off the roller. We'll keep the ball, placing the roller to the side, grabbing a 3-pound weight. Actually, let's use the roller. We'll place the ball between the knees, stepping back onto the roller, hinging forward from the top of the hips this time, taking the arm out slowly, lifting it up. 2, 3 for a back fly and down. 2, 3. Lift up. 2, 3. And down. 2, 3. Keeping the chin retracted, lift the arm. 2, 3. Think about puffing the upper back up, but not lifting out of your hinged position. So it's as if there were hands hovering over the shoulder blades and you were just trying to puff the upper back up to meet those hands. Brace the abdominal wall. Stick your booty out so your tailbone is reaching away from the crown of your head in opposition. Feel the feet wrapped around the roller, the inner thighs squeezing in on the ball. One more, lifting up on your exhale. Lowering on your inhale, brace your abs to bring your body upright and to carefully step off of the roller, switching sides. Setting up for a back fly on using the other arm. Hinge forward from the hips, soft bend in the knees at all times, bone of the big toes heavy, and begin lifting on your exhale, bracing the abs. Inhale to lower. Moving on a slow 3 count, taking it up, 2, 3. Inhale, lower, 2, 3. Brace the abs, fog of air. Inhale, lower, 2, 3. Fog. Inhale, lower, 2, 3. One more. Inhale, lower, 2, 3. Let's step off very carefully. We'll place that 3-pound weight to the side, the ball and the roller, grabbing our heaviest Theraband. Stand facing me, but a couple feet from the wall so that when you take a quarter turn and you pull out on that band that's in line with your chest, you come into your piriformis pose, balancing, sitting back, dorsiflexing the foot that's crossed over. Isometric hold here. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3, soft bend in that supporting knee. Make sure that the bone of the big toe is heavy so that you're not rolling out on your foot. Stand up tall and turn back to face me. The important part here is taking a quarter turn and finding your balance immediately. You can lift into knee flexion and then move into this squat piriformis opener position. We did this in our opening stretch, supine, and now we're bringing it upright to get even deeper into that glute med piriformis. To keep the knee safe, dorsiflex that foot that's crossed over and press heavy into the bone of the big toe of the supporting leg. Let's switch sides. Setting up, step to balance, knee flexion, cross, sit back. Inhale 1, breathe. Exhale 1. Inhale 2, exhale 2. Inhale 3, exhale 3, and repeat. Take that quarter turn, crossing the ankle over, sitting back, bone of the big toe heavy. Inhale 1, breathe. Exhale 1, chin retracted. Inhale 2, brace the abs. Exhale 2. Inhale 3, exhale 3, and let's set that band to the side. We'll grab our foam roller, and if you have a pillow, or you can use your anti-burst ball, we'll come for a side lying lat release. Place the ball to support the head as you come into this side lying position, and you're going to play around with the feet, lifting the butt up and rolling forward and back, or doing a twist of the torso back to get into the fascia. The lat attaches onto the armpit, so you're gonna feel a lot of fascia that's tight as you twist backwards posteriorly. So breathe into that as we open up this fascia. Couple more breaths, working into it. Inhale, play around with moving forward and back, twisting back and forward until you find a pocket of fascia that needs your attention. And then hold it on that fascia. Let's go ahead and switch sides. Setting up, moving forward and back, twisting, taking your time. breathing. It's up to you how much pressure you apply. So if you elevate the pelvis, if you really push down into the roller, you're going to get deeper into that fascia. But if it's really tight, you got to be where you are today and use the breath and this roller to get a little more space so that the side body isn't tight and pulling you forward into that kyphotic position. From here, we'll get a chair and our heaviest band to move into an IT band stretch, taking the leg across the body, dorsiflexed, wrapping the band around the arch of the foot, holding the wall for security. The most important thing here is that the supporting knee is softly bent, the bone of the big toe is heavy, and that you stick your tailbone back, arching your low back so that when you fold forward, you're not putting pressure on the low back because you're tucking your pelvis, that you're getting a stretch through the lateral hamstring and your IT band. Breathing here. Inhale 1. And exhale, go further into the stretch, tipping the tailbone up and back. Inhale, brace the abs as you exhale deeper into the stretch. Inhale, brace the abs. Exhale, going deeper into the stretch. Inhale, and come up, switching sides. Setting up on the other side. Take the leg across the body, dorsiflex the foot. Stick the tailbone back. Soft bend in the supporting knee, bone of the big toe heavy. Each exhale is a chance to go deeper as long as your checkpoints, you have awareness. The feet, the bone of the big toes heavy, soft bend in the supporting knee, dorsiflexed foot of the leg extended, internal rotation from the top of the hip socket across the body. Tailbone is back. Extension in the lumbar. Abs are bracing on your exhales. Chin and chest are lifted. Sternum is reaching towards the back body without causing the shoulders to round, so you're keeping the collarbone wide and plugging the shoulders down the back. One more breath here. Inhale, abs in, brace. Exhale, go deeper into the stretch. And come on up. Set the chair to the side. Good job. We're going to grab a 3-pound weight, coming to the top of our mat for unilateral shoulder presses and reverse lunges. So your other arm will do a shoulder press as well. You're going to hold the 3-pound weight in the same hand as the front foot. Let's start with your weakest leg being the front foot, so holding the weight in probably your weaker arm as well. And we'll do a press of the arms as we step your dominant leg back. Inhale here, exhale, press the arms, straightening them, coming back forward. Inhale, prepare, exhale, lowering, bending the elbows. Inhale, prepare, exhale, straightening the arms to step forward. Inhale, prepare, exhale, step back, bending the elbows. Inhale, brace the abs. Bone of the big toe should be very heavy as you're working here. This will ensure the proper knee traction. Keep your focus up eye level. Think more about what's happening in the abs and that front foot than anything. One more time. Bracing those abs. I lied, let's do one more. Breathe in, brace. This is your non-dominant side. We should do a few extra ones on this side. Excellent. Switch sides. Setting up on the other side. Now, if you really have imbalances in the body, if you've had injuries and you have one side that's significantly stronger than the other, I would advise staying on your non-dominant side for the majority and just doing a couple on your dominant side. We really want to balance out. I want, by the time you've gotten all the way to level 6 with YouniquelyFit, you to tell me that you don't feel a difference in the side, each side. You don't know which side is your dominant side. That's when we'll know you're really, really balanced. So you should be doing your presses, your reverse lunges with that full breath before you press back. We're only moving on our exhales. So your inhale, prepare. Exhale, bend the elbow as you step back into the lunge. Inhale, prepare. Exhale, shoulder press to step forward. One more time. Inhale, prepare. Exhale, bending the elbows to go back into the lunge. Bone of the big toe is heavy. Exhale, press into the bone of the big toe as you step forward, bracing the abs. We're going to move into some balance work in the sagittal plane. You need your 3-pound weight, and you need to stand by a wall for security. The weight is in the outside arm. We're going to step. Let's start actually with the right side of the body to the wall profile so that the weight is in your right hand. And you're going to step your right leg forward, kicking your left heel towards your butt, dorsiflexing the foot. Moving into dancer's pose here. Soft bend in the supporting knee, weight in the bone of the big toe, bracing the abdominals. Inhale and exhale. Inhale and exhale. Good. Stepping the feet together. And we'll repeat that stepping back. So stepping your right foot back, kicking the left heel towards your butt, finding the balance. Moving into dancer's pose. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Bone of the big toe heavy. Inhale 3. Exhale 3. Turn around. We'll repeat on the other side. Stepping forward on the left foot, kicking the right heel towards your butt. Dorsiflex that foot. Dancer's pose. Inhale 1. Breathe. Exhale 1. Left bone of the big toe heavy. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Take that right foot down. We'll step the left foot backwards, kicking the right heel towards the butt, finding the balance. Last time, stretching into dancer's pose. Inhale 1, breathe. Exhale 1. Bone of that left big toe heavy. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Go ahead and set the weight to the side, facing the wall for a wall V stretch for the bicep and anterior delt, twisting away. Soft bend in the knees, brace the abs. Inhale 1, brace the abs, rotate a little more. Exhale 1. Inhale 2, brace those abs. Exhale, twist away. Exhale 2, retract your chin, make sure the head's not forward. Inhale 3, sternum reaching towards the back body. Exhale 3. Inhale 4, brace those abs. Exhale 4, we're going to 6. Inhale 5, brace the abs, rotate. Exhale 5. And last time, inhale 6, twisting, shoulders down the back. Exhale 6. Let's switch sides, setting up by facing the wall. The outer edge of the thumb is on the wall, shoulders plugged down the back, and we're twisting away from the wall, opening up the anterior delt, the front of the shoulder, the bicep. Keep twisting on your exhales. Inhale, navel in, lift up on the muscles that stop your stream of pee, and twist. Inhale, abs in, lift up on those muscles that stop your stream of pee, and twist. 2 more. Inhale, brace the abs, exhale, and twist. And one more time. Inhale, abs in, brace, exhale, and twist. We'll grab our chair, moving into cow position with the hands on the chair, feet hip distance apart. Grab your ball to pin between the knees, just so you know that your legs are hip distance apart. From here, tip your tailbone back, lift your chin and chest up. Inhale, brace those abdominals so that while we're in extension, the low abs are active and supporting the lumbar. Eyes are looking up as you extend into this cow position. Inhale, abs in, brace, and exhale. Let's get a little movement in the head now. Nodding the chin to the chest, rolling it over one shoulder, and back in the other direction. There's no movement in the upper body or the lower body. It's just that head. From the neck and the head, that is the only movement we've got. Rolling from one shoulder to the other, allowing the neck extensors to release. Do 2 more. After your last one, center that head. Inhale, brace the abs. Exhale, give me one final lift to the pelvic floor. And Great job.